This just in, there's been a recent surge in the human immunodeficiency virus and acquired immunodeficiency syndrome, more commonly known as HIV and AIDS.
HIV causes AIDS and interferes with the body's ability to fight disease by attacking cells that fight off infections and disease. Then, diseases and infections can take over the body, signaling that the person has AIDS. AIDS is the most extreme part of HIV because the immune system is so damaged. People who get AIDS begin to develop an increasing amount of severe illnesses known as opportunistic infections.
HIV is spread only in certain body fluids from a person that already has HIV. These fluids are blood, semen, preseminal fluids, rectal fluids, vaginal fluids, and breast milk. In the US, HIV is spread mainly through having sex or sharing injection drug equipment such as needles with someone who has HIV.
How often are people affected by HIV? In 2014, 6,721 deaths were attributed directly to HIV. Worldwide, there were about 1.8 million new cases of HIV in 2016. About 36.7 million people are living with HIV around the world. An estimated 1 million people died from AIDS-related illnesses in 2016. An estimated 35 million people have died from AIDS-related illnesses since the start of the epidemic. Sub-Saharan Africa, which bears the heaviest burden of HIV and AIDS worldwide, accounts for 64% of all new HIV infections.
HIV started when hunters in Western Africa killed and ate infected chimpanzees. Now, more than 36 million people worldwide are living with HIV/AIDS, more than two-thirds of them in Sub-Saharan Africa. At least 2 million infected adults live in each of 5 countries: Ethiopia, India, Kenya, Nigeria, and South Africa.
How would you know that you have HIV? Within a few weeks of HIV infection, flu-like symptoms such as fever, sore throat, and fatigue can occur. Then the disease is usually asymptomatic until it progresses to AIDS. AIDS symptoms include weight loss, fever or night sweats, fatigue, rashes, and recurrent infections.
The primary test for diagnosing HIV and AIDS is the ELISA test. ELISA, which stands for Enzyme-Linked Immunosorbent Assay, is used to detect HIV infection. If an ELISA test is positive, the Western blot test is usually administered to confirm the diagnosis. Without treatment, HIV infection progresses to AIDS in approximately 10 years, with death following within 3 years after onset of AIDS. With appropriate treatment, a 20-year-old with HIV infection can expect to live to reach 71 years of age.
No cure exists for AIDS, but strict adherence to antiretroviral therapy can dramatically slow the disease's progress, prevent secondary infections and complications, and prolong life.
Using condoms really lowers your risk of getting HIV. If you're going to have sex, using condoms every single time is the best way to protect yourself from HIV. There's also a daily pill you can take called PrEP that can help prevent HIV. Your doctor or nurse can tell you if PrEP is right for you. Also, don't share needles with anyone.